Hello, my name is Rommie Johnson, and I'm the Program Director for the Ambulatory Surgery Center and Office-Based Surgery programs here at the Accreditation Commission for Healthcare, or ACHC for short. Special thanks to Garfunkel for organizing yet another great lineup for this symposium, and thanks to you for joining me today in getting a good high-level overview of how to not only get accredited, but stay accredited and be successful. I've been in the accreditation industry for over a decade now, not only within ACHC, but other two major accreditors as well, specifically in the ambulatory surgery center realm and office-based surgery centers as well. I've had a chance to work with medical groups across the country, so I'm really delighted to be here today to kind of share some of the tips and tricks and really some of the things that you can put in place to be successful for your surgery center as you're thinking about accreditation. So enough about me. Let's go ahead and jump into some of the quick facts about ACHC before we move forward. So ACHC has its roots in North Carolina, but has actually grown to be the nationwide accreditor of over 29,000 of locations spanning the continuum of care. So pretty much if you have a healthcare setting that needs to become accredited, we have a service to help you out and to help you get there. The ASC program itself has actually been approved by CMS since 2003, when it was previously known as HFAP. Some of you today might recall that name might be familiar to you all, HFAP. But since 2003, the ASC program has been approved by CMS. And actually, just a couple of weeks ago, we received yet another approval thereby extending that deemed status program. So, a lot of ASCs come to us or to ACHC rather, for the customer service. They know that we're already approved by CMS. So it's something that has been established for quite some time. On the office-based practices, for some of you that maybe might oversee office-based practices or maybe are thinking about it, that itself has been around for a while as well. We just did some revamping earlier this year to make it more streamlined and to really, hearing the voice of the customer, making sure that everything is aligned to what those practices typically see. Other than that, as you can see on your right there, your screen, we do have other entities, mainly educational resources. That's the ACHCU for university, and Health Train U, which is sort of the learning management system. Now, as I mentioned before, we ACHC accredits across the continuum of care, over 29,000 locations. And what you're seeing here is a good snapshot of all the settings that we accredit. So as you're thinking about, expanding throughout the healthcare continuum, certainly, you have options out there in order to help you meet the needs of either payers, regulators, what have you. As you can see here, this is a very, very good snapshot of what ACHC covers. So let's go ahead and jump into why you're here today, right? Getting accredited and staying accredited. But before we get to that, for some of you that maybe might be jumping into compliance or accreditation for the first time, I thought it might be nice to kind of dive a little bit and very quickly on understanding what accreditation actually is. So what exactly is it? In a nutshell, you can think of accreditation as I'll be honest, quite frankly, it's definitely not an easy undertaking, but it's a worthwhile undertaking, and it is critical to signifying that your facility, that your team, and that everyone else that you partner with have met a certain level of nationally recognized standards and guidelines, such as the ones that, again, are provided with ACHC. And quite frankly, there are a few others out there as well that offer accreditation. So really, it's a mark, it's a rubber stamp to say that you're doing what you're supposed to be doing in a safe manner. And along those lines, who provides this type of accreditation. Like I mentioned, there are a handful, probably in the ASC world, there are 4 major accreditors out there that offer programs that maybe, might cater to you. And, especially if your ASC is trying to become CMS deemed or, to meet any state requirements, certainly there are at least 4 accreditors that can help you meet your needs here. And the why here then becomes, okay, so why exactly would we even go through this, right? And as you can see here, in a nutshell, the key takeaway here is, most folks that come to their different accreditors, they go to them for different reasons. Number one is, first of all, we want to be operational. So, we have to meet certain level of state requirements. Number two, and perhaps it's probably the most important, is we know that, for certain states that maybe might not be mandatory, they go to an accreditor because they generally want to improve the care that's being provided. They want that third party to come in and assess, okay, are there some blind spots that we're missing here? So it's definitely a way to enhance your reputation, is a way to enhance the quality of service you provided. And at the end of the day, to be fair, it is a business. So, accreditors, out of the four that I mentioned, a couple of those accreditors are actually approved by payers such as Blue Cross Blue Shield, Aetna, and what have you. So from a business perspective, accreditation becomes vital because it allows you to demonstrate to those payers that, hey, we have had this outside party come in, they've validated our processes, they've validated how we credential and privilege our providers, and really validated that we are providing good, high quality care. And so as far as ACHC is concerned, you might be wondering, well, out of, I mentioned four, I mentioned three accreditors. From ACHC perspective, since we're already approved by those payers, since we're already approved by CMS, for us, the key difference becomes, okay, what type of resources and ongoing support can we provide to make you successful? So typically what you'll see on the front end is we'll front load the resources so that the process is as easy as possible. So with that high level understanding of accreditation out of the way, now I would like to jump into sort of what I've seen again over the past decade that has worked for successful ASCs that are going through the process. So, and that's really about how do you prepare, right? You and your partners, or maybe you're a solo provider and you're trying to get started, or maybe it's a provider that has hired, a legal team to say, hey, help me out start an ASC. How exactly would I recommend you go about this? Now, it might seem a little bit too obvious, to say establishing a timeline, but you'd be surprised. There are a lot of folks that typically will overlook this process of, hey, what's our timeline here? What do we actually have to work with, depending on state requirements, and if we do go with an accreditor, what is their timeline as well. But I highly recommend sitting down with the team and kind of going through these 4 or 5 areas that I'm showing right here. And what actually would be best is to work backwards, right? So you and your team get together and say, we would like to be accredited by a certain date. Then you would work backwards to say, okay, we'd like to have a survey by a certain date. We'd like to gather all our policies and procedures, kind of working all the way back to the team, because, and you'll hear later on, I emphasize a lot, putting together a team. Now, a team doesn't have to be, 11 people, 50 people. Sometimes it can be a team of 2, but really it's more about understanding and delegating. Okay, what do I expect you to do, and what do I expect my partner to do in order to make this successful? But certainly, in a nutshell, you have to establish a timeline. This will help you and help ease a lot of the pain in the back end, as you continue through the process. The other piece of it that I always tell folks to really pay attention to and to really dedicate some time on is on mock surveys and conducting self-assessments. So what you're seeing here, for example, is a report that's usually published every year, and sometimes we'll publish it twice a year, but certainly every year we'll publish, ACHC publishes a list of the most frequent deficiencies. So this is, we'll take up the previous year, take a look at all the surveys that were conducted and say, what are the top 10 or so deficiencies? And really the purpose for this is more to highlight and to help educate surgery centers. And this is something that you can do even if you're not accredited by ACHC. Certainly you can take a look and see, and benchmark, so to speak. But as far as mock surveys, this is one thing. Once you have a timeline in place, you certainly want to kind of put on the hat. You're already wearing multiple hats, so what's one more, right? But you want to put on a hat and say, hey, I'm a surveyor. I want to walk through the facility and say, do we have, is our medication management up to date? Is our life safety code up to date? Kind of going through all of that. You can certainly hire outside to have someone walk through that. But at the very least, whether you're hiring from outside or whether you're doing it yourself, I highly, highly recommend that you conduct the mock surveys. And so if we take a deep dive into this report that I just mentioned, that's the one that's expanded on the left. What you want to do, for example, here, you're thinking about, like I mentioned, medical records. This is one of the ones that was the highest frequency as far as deficiency are concerned. What you can see in this report is, you and your team can then use a report like this to kind of go over, okay, what's the requirement, and what was the comment on the deficiency? And then you can take a look within your facility and say, is this something that we're doing? Do we have we done a risk assessment to make sure that we are catching this type of deficiency that is commonly seen within other AACs? Here we do ACHC does include the frequency of the citation. For you, it might be important to sort of benchmark and see how others are faring. But really, to be quite transparent, as long as you know what the requirement is, what's typically seen, and what are the tips to kind of get you into compliance, that will get you on the right foot to say, okay, now we have done with this chapter, let's move on to the next session, maybe infection control. We know that's a huge area within ASCs as well. Key takeaway here, definitely establish a timeline. Definitely take some time to go through your center and your facility and do a mock survey. Again, whether it's yourself doing it or whether you're hiring from externally, you definitely want to go through this process. It will help you immensely. So beyond the survey, now the surveyors have showed up, you were successful. What happens? I like to tell folks whenever, I'm talking across the country, I tell folks, accreditation goes beyond the certificate on the wall. It's great. It's definitely a great symbol to show that your team has worked very, very hard, months leading up to the survey. And absolutely, you definitely want to showcase that. But to be really successful and to really remain accredited beyond that first cycle, there's certain things that I definitely also recommend that you keep an eye on. Number one, again, it's going to sound obvious, but certainly it can be easy. It's easy to overlook, especially as you all know, in the ASC world, there's a lot of turnover. Maybe the administrator turnover, the ownership usually stays, quite stable unless, a large corporate firm comes in and sort of is interested in acquiring. But typically the ownership stays quite stable, but the folks that are actually doing the day-to-day might change. So it's important that you have a really robust training and education program. Now, most accreditors, to be fair, are not going to be, they're not going to be prescriptive as to what type of education that looks like. It just has to make sense for the services that you're providing, for the number of staff, and sort of the avenue in which you're going to provide that education. The other piece I mentioned in the front end, you want to do the mock surveys, but ongoing, you want to make sure that you're doing regular audits and self-assessments. Most of the accreditors, typically, when they come to your facility, and let's say you're successful, they won't come back again in 3 years' time. So typically, the accreditation cycle is for 3 years. From time to time, some accreditors might pop in, a year afterwards for a follow-up survey, and even beyond that, CMS or the state still has the right to pop into your facility, so to speak. So you want to make sure that you're doing regular audits. You celebrate, you pop the champagne, but then after that, you kind of get back into game mode and sort of making sure that you're not missing any blind spots as you continue your operations. The other piece is obviously staying updated with the regulations. CMS changes the regulations almost all the time, especially in the ASC world. The most recent one, was obviously the removal of to the accreditors. They had the change where they removed the COVID testing requirements. Now, there's still some debate going on the data being required of ASCs, but as far as the accreditation is concerned, you won't see that in your accreditors manual anymore. So you definitely want to stay up to date with regulations. And each accreditor typically also releases annual revisions. So you want to make sure that you're up to date with the current manual for whichever accreditor that you select. That way, again, as you're doing those regular audits, you make sure that you're actually comparing apples to apples, and that when the surveyor shows up, you'll be ready to go. The other piece is trying to, and this is tough because again, some surgery centers, you're a very small team, very lean team. And so it can be tough to put together a very robust quality improvement program. But certainly, all of the accreditors have some requirements regarding establishing a quality improvement program or process. So you definitely want to make sure that, you kind of work in bits, step by step. We're not asking you to kind of, go full out, creating a full CDC, quality improvement study. No, it's just something that makes sense for your facility. But certainly you want to make sure that you're showing to the accreditor that, yes, we are constantly, whether it's hand hygiene, whether it's emergency preparedness, that we have a program in place to periodically take a look at areas that might be high risk. The other piece is the patient. So we can't forget about the patient. I've talked about payer, state, the business aspect, but the patients, they are the ones that are actually going to come to your surgery center, and how they get involved besides them getting the high quality of care is their feedback and satisfaction. At ACHC, feedback is important to us, to where we'll follow up with someone that scores on a 5-point scale. Anyone that scores 3 or less, we'll actually follow up with them. For you and for your partners, you can have your own criteria, but at the very least, you want to make sure that you have a way to capture that feedback and satisfaction, and a way to respond to that. Because again, the patient at the end of the day, they're getting more choices out there. There are a lot of surgery centers opening up, so it behooves you really to make sure that you're capturing that. And then finally, the benchmarking that I mentioned, this is sort of related to the quality improvement program, but you certainly want to make sure that, bar any sort of competition within your region, if you have surgery centers that are willing to share data, willing to benchmark, certainly that's something that's highly encouraged to help you stay accredited in the long term. And also, there are a lot of associations out there. You got the national one, ASCA, for example. You have regional ones that have benchmarking criteria or benchmarking tools. Certainly, you want to take a look at that and see how that can help your facility. So, just kind of wrapping up, again, this is very, very high level, but, I wanted to go over some of the quick takeaways. Number one, like I mentioned, you want to set up a team. And importantly, you want to set up a process champion. This is going to be your point person to say, hey, for example, if it's myself, say, Rommie, you're the point person, you'll assign a team, and maybe within that team, you want to have them be responsible for certain chapters. All the accreditors have several chapters, at least 10 or more chapters. And it again, can be daunting to ask just one person to be in charge of all 10 chapters. So instead, what you want to do is kind of divide and conquer. But certainly at a minimum, you want to set up a team and a process champion that will also be the liaison between your facility and the state, or your facility and the accreditor. Second quick takeaway here, again, documentation. You'd be surprised, most folks, obviously, a lot of the egregious quality issues typically tend to be non-documentation issues. Although, for example, if, I'll give you an example, maybe allergies, for example, if you don't notate known allergies and the reactions to them, that can result into an adverse event. But in any case, besides the sort of the wrong side surgery or anything like that, documentation is another key area where we see a lot of findings. A lot of folks either don't have the policies in place, or, and this is the worst, well, probably even worse, arguably, they'll have the policy, but they're not following it for whatever reason. Maybe it hasn't been updated. Maybe whoever updated has left, but there wasn't that continuous education, going back again to what I mentioned before. So you definitely want to make sure that you align your policies, number one, with what the state and the accreditor requirements are at a minimum. If you want to have more than what they require, that's up to you. You just now have to follow them. But certainly do not ignore the documentation piece. It's an easy, it's sort of an open book test. It's the easiest part to make sure that it's aligned. You just have to kind of drill that into to your team, make sure that it's updated. The third takeaway here, mock surveys. Again, you want to think like a surveyor. I cannot stress enough, a lot of folks get very nervous during the survey. You might even see some of your staff members trying to run away, but no, again, get buy-in from your team. Let them know, hey, we are a team, we have prepared, we know what we are doing, right? An accreditor can come in, they might have their thoughts. By the end of the day, you have gone through the training that you've gone through. We have done all our mock surveys. We have gone through this. It's a couple of days. Most surveys are about 2 days, maybe 3 if you're unlucky. But most surveys are 2 days. And so, 2 days, we'll focus on what we do best. So and part of that is doing the mock survey so that your team is familiar with that process. And then finally, the other takeaway, if anything can get from today's sort of high level overview, is that ongoing compliance. Again, the certificate is great. Once you get the dimming and your CCN number is perfect. That's absolutely a mark of the hard work that you've done. But you want to make sure that you sustain it. You want to make sure that, in a year, if CMS decides to pop into your surgery center, they're not going to, suddenly find, egregious findings to where they can take away your hard work. So ongoing compliance, I cannot stress this enough. You definitely want to, whether it's sending your team to, to take any continuing education courses, or whether it's just kind of seeing what's out there in the industry. For example, I mentioned associations. Typically, I'd say most of the national associations, as far as ASCs are concerned, they typically will have a blog or they'll have a forum where other surgery centers or other administrators can go in. And so I highly recommend, most of them, they don't charge you to have to be part of that forum. And I can tell you, you'll find some really, really helpful tips there about ongoing compliance. You kind of see what other folks have seen in the industry, and you can implement that within your facility. So, and especially when it comes to things like life safety code, infection control and life safety code are probably two of the most notorious areas, so certainly as you're starting at ASC, you want to make sure that you hire a very competent life safety code person because guaranteed that's probably going to be if there are any findings, you're going to find them there. But certainly, going back to the forums, you want to take advantage of anything that's free out there that can help you stay accreditation ready. If CMS decides to come in, you'll be, it will be because they're usually unannounced. Actually, they're always unannounced, the CMS surveys. So you want to make sure that you're ready. And again, if there's anything you can take away from today, get a team in place, sort of have that mindset of always being ready and conduct the mock surveys. That will help you tremendously. So, on the right there, I just included a quote from an ACHC customer, and really here the focus was on, again, the help, right? Your team and everyone else that oversees your team, they are wearing multiple hats. So what exactly can an accreditor do to help you be successful? And that's what I'm going to go through here. As you're selecting an AO, I joke a lot that in the compliance and especially in the accreditation field, we tend to almost overuse acronyms. And so here the AO stands for Accrediting Organization. But as you're thinking about starting up your ASC, or maybe you've worked with ASCs for many, many years, certainly when you're thinking about selecting an accrediting organization, you want to make sure that whichever AO you go with, they have an education first approach, right? They actually have your best interests in mind to where they can say, hey, thank you for selecting us. This is how we can help you make sure that you're successful. So definitely the education piece is going to be key for you. The other piece is that you want to also select an accrediting organization that they themselves have a version of some sort of internal quality control or quality management system. It's sort of the accredited of being accredited, right? You want to make sure that if they're asking you of certain documentation or certain practices, that they're also holding themselves accountable. So typically on the website that you might see maybe some notation on how the accreditor is keeping themselves accountable, but certainly you want to make sure that at least you look for that as one of the criteria. The other piece is you want to look also, for example, total joint arthroplasty is growing, is booming. And so, certain accreditors are looking to get certifications or add-on certifications that can be recognized by payers. So as you're selecting an AO, you're not just thinking of today, as you're opening your surgery center, you want to think about maybe 3 years, 5 years, where do we want to be with sort of the services that we're offering? And can this accreditor be able to help us, sort of engage the payers by offering some sort of certification. So you want to look for an accreditor that's able and ready to really accommodate your growth. The other piece is the consistency of the process. One of the things that you'll hear is, I love my accreditor, but I feel like there's some inconsistency from what I hear from the headquarters staff to when the surveyor shows up on site, and then what happens after. Certainly, that's a pain point, something that comes up year on year. And like I mentioned, the past 10 years, I've heard it quite a bit. And so you want to look for an accreditor that's at the very least, has processes in place to reduce that inconsistency. Surveyors are human beings, so things are going to happen, but you want to find an accreditor that also is not just going to ignore that that element and that variable. So certainly that's something that will also help you. That way your team knows that they're getting, at the very least, a consistent answer throughout the process. And then finally, you want to look at an accreditor that not only is big on the education, but also customer service. And what I mean by that is when you pick up the phone call to ask a question to the accreditor, you want to make sure that first of all, you're not being sent to voicemail. Secondly, you're not being bounced around to 7 different people. It can be frustrating. You just want a simple answer. So, when you're doing your research, you definitely want to make sure that the accreditor has a system in place to where they have a point of contact that you can know you have a dedicated point of person that can answer your questions. Even if they're out of office, they have a backup in place, because that will help you as well. Time is money. So, the longer you're waiting on an answer as you're doing a mock survey, or maybe you're on the surveys on site, you don't want to be waiting, for that answer. You want someone that's going to be responsive, and even better yet, someone that maybe has been assigned directly to you. Again, I don't think personally all of these are too much to ask. Accreditation is an investment, time, people investment, and monetary investment. So at the very least, you want an accreditor that can at least touch upon 90% of what you're seeing here. So, just before I close, on the ACHC different, I mentioned, we accredit, ACHC accredits across the continuum of care. And really the key takeaway here is on ACHC's really drive and dedication to, education approach, the customer-oriented approach. As you can see there, like I mentioned, the reason why you see the customer satisfaction at 98% is really anyone that scores a 3 or less out of a 5-point scale, we reach out to. We try to see how we can improve and how, a situation can go better next time. And so, the difference here as you're thinking about this level of investment is, what type of support am I getting on the front end and after the accreditation? What type of surveyors am I getting? Are these folks that actually know the ASC world, or am I getting hospital surveyors? You certainly do not want to, get surveyors on site that have no idea of what goes on day to day. And then the other piece of it is obviously, from a pricing perspective, what type of accreditor am I going with? As most of you know, some states can satisfy the deeming process for you, and they're much, much cheaper, much more cost-effective option. So if you're selected to go with an accreditor, you want to make sure that, hey, at least all these points are touched on and the pricing is reasonable enough to justify us going through this voluntary process. That's some of the things to take with you as you go through the rest of the sessions, the rest of the today. But other than that, if you have any questions, on your screen is my direct contact information. We also have a general line in case, again, you have follow-up materials with us. But certainly, again, on behalf of ACHC, I do appreciate the opportunity. And again, thank you for Garfunkel for putting together this wonderful set of speakers here to help the industry experts out there. Thank you.